One of the things that I'm curious about to try to understand as we go through this conversation is what's the prevalence of COPD? And then to you, what does that mean in terms of the economic burden of disease?
16 million diagnosed, 30 million probably total in this country, many of them undiagnosed, over 300 million around the world. This is a major health issue and one which is not going away. It's a disease that impacts every level. It's not just a disease of the elderly. The majority of people with COPD are in the workforce, which, as Maria knows, it leads to issues of absenteeism and presenteeism. It has tremendous financial burden beyond the $50 billion a year that medical costs entail.
Absolutely. Yeah, and just to add to what Byron is saying, on the health, health cost side, we're seeing over 400,000 admissions a year responsible for this condition. Often these patients can be readmitted, ER visits, antibiotic use, not to mention PCP visits, pulmonologist visits, and other specialists, as well as imaging. We also now have low-dose CT for screening and for hopefully early detection of lung cancer for patients who are smokers. So a lot of focus and effort, and certainly major, not only direct cost impact on the health system, but as Byron alluded to, absenteeism, presenteeism, symptoms that often lead to certainly additional costs and a major health economic problem. It's actually, COPD is second only to heart failure also in readmission rate. So important to keep that in mind.
I think that, Marie, you might want to stress the presenteeism issue. It's easier for businesses if someone doesn't show up, because if there's work to be done, you can find someone else to replace them. If someone shows up, but they're not well enough to work to the level you used to, which is what presenteeism is, it's much more difficult for businesses to understand that, and makes defining the impact of that much more complicated.
Yes. Challenging, though, to measure, and I think most payers would have a hard time when they, obviously if it's their own employee, that may be important, right? Because we're all consumers of healthcare. But for a large employer, what that may mean, not only in terms of absenteeism, but you're absolutely right, presenteeism, how much more productive somebody could be if they were fully functional. Absolutely.